Hi, Patty.
Hi.
I'm Mr. Moore. I'm going to be
Hi.
your clinical instructor today.
Great, thanks.
You're here for your patient safety,
Yes.
right?
Yes.
Let me give you a tour,
Okay,
okay?
thanks.
Come right over here. We have everything laid out here on the counter for you today. This is your medication for your medication administration, so you don't have to use the Pyxis today. This is your drug book to look up your medications. These are your oxygen supplies that you might need, okay?
Okay.
Gloves, note-taking device, and calculator for doing your medication administration calculation if you need it.
Great.
Okay, and come on over here and we'll show you your patient. This is Elsa Martinez. She's going to be your patient today.
Okay.
We have our sharps container over here. We have IV of normal saline, simulated running at 125 milliliters an hour
Okay.
in the right-hand cubital. Your patient is user-friendly today, won't code on you.
Oh, good.
But she does have all of her vital signs and respirations and things that you'll need to do your treatment evaluation
Okay.
for your patient
Good.
today. When you do your blood pressure, right here in the flat spot, the reason for this flat spot, the speaker's underneath there where you're going to hear
Oh.
your blood pressure.
Good.
Okay. And then for your pulse, there's a ridge right here. If you feel that, the pulse is right there.
Oh, yes, I feel it.
Okay.
And that's the speaker. Okay.
I'm
Got
going
it.
to be the voice of the patient today.
Okay, good.
Okay. And you have your ID bands and your allergy bands on the patient.
Great.
There will not be any information on your monitor today.
Okay.
You'll have to do your vital signs manually.
Okay. Mm-hmm.
Okay. So, and this is your patient chart.
Okay, thank you.
And in your patient chart, we have a medication administration record
Good.
for any medications that you might want to need to give, your doctor's orders,
Okay.
your patient report, and we will go over that today.
Okay.
And then we will also go over our instructions for the day, which I will get.
Okay.
And these are instructions for today.
Okay.
So the mannequin again is turned on, breathing. We'll treat the mannequin as you would a real person in real life, performing safety checks and vital signs as you would in real life. You don't need to do a focused assessment today. I will be telling you the things that you need to do for skills.
Okay.
And you do not need to do a temperature today as part of your vital signs.
Okay.
The IV pump is not on, but is simulated, and you're to assume it is running the IV fluid at the rate that is posted on the pump. Again, that showed 125 milliliters an hour. If your patient needs IV medication today, actually administer the medication using the proper procedure, and not saying I'm going to do this, but actually doing it.
Okay.
I will be the voice of the patient and will answer questions relevant to your patient care. We talked about your patient chart there, having the medication administration MAR for the medications that you need to do today.
Okay.
You may write on that MAR, but please don't write on any other part of the chart today.
Okay.
No other patient documentation is required. Again, we talked about where your supply cart was, and your medication is there on the counter as well. And you may dispose of any syringes and vials you use today in the sharps container just as you would in the hospital.
Okay.
Remember, this is an evaluation and I will not be guiding you, except there's a technical problem. We can call a timeout, fix whatever the issue is, and then go back to the
Okay.
process. Remember, what happens in a smart hospital stays in a smart hospital. I like to say we're an equal opportunity anxiety producer in students.
I am nervous.
So, ready for report?
Yes, yes, let's do it.
Okay. Again, you can follow along there,
Okay.
and we'll talk about your patient. It is day 2 for your patient at 7:30 a.m. For purpose of this scenario, it is between 7 and 8 a.m.
Okay.
Ms. Martinez was admitted to the medical unit about 2 hours ago from the emergency department after having been diagnosed with pyelonephritis. She has a long-standing history of lupus. She also has orders for oxygen to be placed and is due for her morning meds.
Okay.
Her IV of normal saline is running at 125 milliliters an hour. So today I want you to do these following 4 things.
Okay.
Follow all patient safety requirements. Apply oxygen as ordered.
Okay.
Perform vital signs, blood pressure, pulse, and respirations. You do not need to do a temperature.
Okay.
And administer the medications that are ordered between 7 and 8 a.m.
Okay.
Okay?
All right. I'm just going to look at the orders for a minute.
You may have a couple minutes to look at the orders, and we'll begin when you're ready.
Hello, Miss Martinez.
Come in.
How are you doing today?
Oh,
My name is
I'm doing
Patty.
okay.
Oh, thank you, thank you. My name is Patty, and I'm going to be your nurse today. May I get your name and date of birth, please?
March 28, 1990.
Okay,
Elsa Martinez.
thank you. And do you have any allergies?
Yes, I'm allergic to phenergan.
Okay, thank you. And so, how are you feeling today?
I'm okay. I'm just tired.
Oh, tired. Are you having any trouble breathing?
Well, I'm a little short of breath.
Well, may I raise the head of the bed up? I know you have pyelonephritis. Are you having any? Oh, I went higher than that. Are you having any pain anywhere?
No, I'm not in any pain.
Okay, on a scale of 0, no pain, to 10, horrible pain, what would you give your rating of pain?
It's a 0.
Okay, 0. So you're fairly comfortable. We just need to address your breathing. The doctor ordered some oxygen to put in a nasal cannula at 3 liters. I'm going to go leave the room and get that, and I'll be back, okay?
Okay.
All right, thank you. Hi, Miss Martinez. It's Patty, I'm back. I've got your nasal cannula.
Oh, good.
I want to try and help you feel better. Did raising your head help you at all?
A little bit.
Okay, I'm going to ask your name and date of birth again, please.
Elsa Martinez, March 28, 1990.
Okay, and are you allergic to anything?
Phenergan?
Okay, that is confirmed on in the chart. Now I have this nasal cannula, and doctor wants you to have this so that it will help you breathe a little easier. And have you ever had this before?
No.
So this has a little flat piece that goes against your upper lip, and the little prongs go up inside your nose. And I'm going to put it all around your ears, and then tighten it a little bit under your chin. Is that okay?
It feels okay.
Then I'm going to put the oxygen on, and so you're going to start to feel a little air blowing in your nose. Not too much, but let me know if you feel dry. And I put the oxygen on so that the line is right in the middle of that little ball there. So how's that at this time?
It's okay.
It's okay?
I can feel it.
Okay. So are you having any other pain or problems that I can help you with?
Not right now.
There's an order for a medication that's due at 8, and it's about 7:30 right now, so I'm going to leave the room and get that prepared and come back and give you your medicine. It's a steroid, and it should help you feel better. So I'm going to leave the room now, and I shall be right back. Oh, I've got to get your blood pressure. It's kind of an important piece before we give you any medications. I wanted to do your oxygen first because I wanted to do the ABCs. Now I'm going to take your blood pressure. And it's going to squeeze a little bit. Maybe I'll take your blood pressure. There we go. And let me know if it feels too hard for you. Okay, I heard 128/80. Sorry. And I'm going to take your pulse now. I'm going to use this clock that's up here. And I'm going to count for a minute because that way I don't miss anything. Okay, I have 76, and I'm going to count your breathing. May I put my hand here?
Yes.
Thank you. At 16 breaths per minute. I'm going to go now and get your medication, and I'll come back with that. Okay?
Okay.
Hello, it's me again.
Hi.
Hi, Miss Martinez. I would need your name and date of birth again, please.
Elsa Martinez, March 28th, 1990.
Great. And any allergies that you have?
Just Phenergan.
Okay. I'm going to check your IV site while I'm here. And do you feel any pain when I touch this?
No, it feels okay.
It's no pain. It's not red. There's no infiltration. There's no warmth. Everything looks really good and like it's flowing well. I see that the fluid is not expired and it's running at 125 ml per hour. Okay, good. All right, I'm going to get your medication ready. And then we can help you feel more comfortable. Now this is dexamethasone, and as I said, it's a steroid. What I need to do is check your compatibility with your normal saline so that I don't have any problems with that at all. And in the back that has this little solution compatibility, and it does tell me that normal saline is indeed compatible. Now I need to go find the rate of administration so that I can IV push that correctly. So takes me a minute to find that stuff. I follow the alphabet. Here we go. So I'm going to give that, it says in the book that you can give rapid IV or bolus administration may result in bradycardia, so we don't want to do that. We'll instead push it over the prescribed amount of time. So we're going to give that IV push over 1 to 2 minutes. Let's see if anything else is. Want to make sure we have it all right. May be diluted, but I don't have to. Okay, I am going to draw this up now. First, I'm going to wash the top of the port and double check with my R's that this is dexamethasone, 2 milligrams. It's in a 4 milligram per mil, so I'm going to give 1 mil of dexamethasone. Make sure I don't touch the parts. One mil will be 2 milligrams. I usually push just a little bit back so that I'm right on when I have all my bubbles done. I'll scoop this top back on. There we go.
It looks good.
Thank you. Okay. Now I'll take the MAR with me. And I am going to check one more time. Your name, please, and date of birth.
Elsa Martinez, March 28, 1990.
And do you have any allergies?
Phenergan?
Okay, that's what I go collect. That is what I see on the MAR. Now, what I'm going to do is cleanse this port right next to you here and wash it for 15 to 20 seconds. And then I'm going to put the medicine in and push it in slowly. I'm going to push it over 2 minutes. Because if I push it too fast, it can slow your heart rate, and I don't want to do that.
And again, use real time today.
Yes, I'm going to do real time over 2 minutes. There we go. Everything's sterile. I could pause a pump, but it's saline, so it's not an issue. And I'm going to go real time now. It doesn't hurt at all or anything?
No.
Good, good, good. Your bed is kind of noisy today. Are you expecting family to come and visit?
Yes, they should be up in a few, probably about an hour.
So you must have been in the emergency department for quite some time before you came to a nice, comfortable bed, huh? Because this is your second.
Those stretchers are kind of hard.
This is really, yeah, I think this is going to help you breathe better and help you rest better. It'll be a lot better for you because it's really been a long stay already. Okay, just a little bit more, but almost a minute and a half has passed. I just want to take my time and push it carefully because I don't want to give you any side effects that you don't want. Are you feeling any other discomforts or challenges? Other than probably being tired because you're now just getting into a comfortable bed.
Yeah, it's just been a long night.
Yes. Well, we'll get it nice and quiet in here. It's early in the morning, but after this medication, you'll have a couple hours you can rest. We've already drawn blood and done all those invasive things, so only about 10 more seconds now. Good. Okay. All right then. Is the head of the bed up high enough for you?
Yes, it's okay.
You're okay enough. Well, I'm going to give you the call bell that's just over there and make sure you're comfortable, okay? And call me if you need anything. And I'll be back to check on you shortly. I think I'm done.
Okay. So Patty, what do you think you did well today?
I check the ID and the allergies every time.
You were very thorough on patient safety.
I was trying to be that way.
What else did you do well?
Well, I like that I did the ABCs first. You know, that I went and I made sure the oxygen was, but I almost forgot my blood pressure. I was a little nervous.
Yep. Expected.
I caught it though.
But you did. You did your ABCs. You rescued your patient. You elevated the head of the bed. You got the oxygen that was ordered. You put it on appropriately and set it at the right amount.
Oh, good.
That was really good.
Good. I was, one thing I could have done better is, you know, I was really looking for that rate of administration. It was hard to find in this book, so I got really nervous then.
Well, there's this book, there's a couple things about it that if you haven't used it before, that you did first, you went right to the back in the chart where the compatibility
That was
is.
helpful, yeah.
Not every drug is on this chart. So if it's not, you go to the drug, and most people would say you're going to go to the compatibility section, but in reality, sometimes that's all about drug interactions as opposed to necessary solutions and stuff. So one of the easy places to find it is under dilution. If the drug can be diluted with the solution, then it's compatible with it.
Oh, good, that's easy.
So here the normal saline is listed. So that's one of the easiest places to look. If you're looking for, is it compatible with another medication you're going to give, that's where you're going to find it under the compatibility section.
Good.
And then as you did, you found the rate of administration there,
Right.
which is very clear.
Good.
Okay.
Yes, thank you.
And the other thing, of course, that you want to look up is any side effects you might want to tell the patient about.
Yeah, I didn't talk too much about that.
Yeah, so that's one of the things you could have done as well, is look up the side effects so you
Okay.
can tell the patient, if you're having any of this, you can, please let me know that's going on.
Good, did I pass?
You did.
Oh, thank you.
In fact, you got everything correct.
Oh my gosh, great.
So,
Great.
and I put comments, I said you followed your ABCs,
Okay.
you elevated the head of the bed, and applied your oxygen by nasal cannula at 3 liters, you evaluated the patient's pain, and you made the patient comfortable. So, yeah, great job.
Thank you, thank you.
Congratulations.
Thanks, I appreciate it.